welcome back to Sickle Cell with O5. I'm the host, O5. And today we have Wumi. Did I get it correct?
Yes,
Wumi,
you
okay,
did.
from Nigeria. And are you in the States or?
I am. I'm based in Seattle currently, but I was born and raised in Lagos, Nigeria, and then came to the US at 16 for college.
16 for college? Wow,
Mhm.
how so young did you, how did that happen?
We tend to graduate early, though. We're on British educational systems. I graduated at 15. And then, I mean, but it's not, most people tend to go 17, 18. I was just 2 years early. So
Got you. Okay, wow. Wow. So how you like Seattle?
it's Seattle.
Yeah.
Uh, it's different. I went to school in Texas, and then I've lived in different places. I've lived in Boston, I've lived in Portland, I've lived in Chicago. So because I've lived in other cities
Mhm.
outside of Seattle, I'm not a huge fan of Seattle. I think um, there's something called the Seattle freeze. They're not as like kind and nice as like southern states. So,
Yes.
but I mean, if you're in tech, then this is where you should be because this is like the new Silicon Valley. But it's not
Wow.
too bad. It
You,
works.
you said they're called Seattle. What are they called? Seattle what?
Seattle freeze. It's just, you know how like you go to Texas and you're like, oh, this is Southern hospitality. So in
Okay.
Seattle, it's the Seattle freeze because people here aren't as friendly as like
Got
people
you.
from.
I did not know. Okay. Does it rain a lot up there or
It does. It
it
does rain
does?
a lot.
Oh
Yeah.
man, I always wanted to visit. Have you ever been to North Carolina? That's where I'm at.
No, no.
Okay. 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 So we're gonna start this off. So do you have sickle cell or are you
So I was born with hemoglobin SS, but in 2019 I participated in a stem cell transplant, and so now I just have sickle cell trait.
wow. Okay. We're gonna dive into that. Now, I asked you this before, but I just want to ask you on the air. Is that the same as stem cell and bone marrow transplant, or what is the difference?
Sure. So right now there are three curative therapies for sickle cell: bone marrow transplant, stem cell transplant, and gene therapy. Bone marrow was done, over a decade ago, and usually for that they would need to find a familial donor. That donor could either be a parent or a sibling. If it was a sibling, it was more of a higher chance of a successful rate. And of
Mm,
course, they would take the cells from the donor's bone marrow. But with stem cells, they don't have to be as invasive. So
mm,
instead, once you have a suitable donor, it's through a machine called apheresis. So kind
mm,
of like if you think of when you go into the hospital and you're getting a blood exchange, right?
mm.
An apheresis machine, what it does is it takes all of your blood components, it takes out what it needs, and then it returns all the other blood products to you. So for a stem cell transplant, they took my brother was my donor. So they took all of his stem cells and then returned all the other blood products back to him. And so he didn't have to go through like surgery for them to go into his bone marrow to retract the stem cells.
Wow. Okay.
Mm-hmm.
So a lot of questions. Okay.
Sure,
So
go ahead.
how old were you when this happened?
I had my transplant later on in life, so I was 32 at the time. I was
Okay.
one of the older patients, yes.
Yeah, nah, you're still young. But okay, so how much blood do they have to take out of your body to like how much blood can be in your body until you don't need it? If that's the right question. Like, is there a certain amount
Yeah,
that's the
let me
standard?
let me simplify a little bit just so that your audience kind of understands the perspective a little better. So my brother was my donor, right?
Okay.
We have the same mother, same father. So the first steps, if you even say, hey, I would like to participate in a curative therapy, the first thing they'll do is called an eligibility criteria. Let's see if you actually meet the protocol to participate in this. One of the eligibility criteria is that you have to have more than 4 to 5 vaso-occlusive crises per year.
Yeah.
I was usually in the hospital every 4 to 8 weeks. That's how
Mm,
frequent my crises were. So when they then found out that me and my brother have both same father, same mother, they did what's is called an HLA screening. The HLA screening then comes back and lets you know, is that sibling a match? For myself, we're only two kids. So if my brother wasn't a match, then I just wouldn't have had a donor. I would still be living with sickle cell disease. But because he was a 97% match, they decided to move forward with my clinical trial. What then happens is I have to go through something called conditioning, which is I go through chemotherapy and radiation before transplantation. He, however, gets injections for 5 days straight. And what those injections do is they tell his bone marrow to produce more stem cells. Every day, there's a certain number of stem cells that your body produces, but those medications escalate how quickly your body is producing stem cells. What they then did after the fifth day was he then went in, they took his blood, all the blood products. Basically, it was imagine if someone is just, it's like you're donating blood, right? And then the machine takes his stem cells and gives all the other blood products back. So for my stem cell transplant, I had 8 bags of stem cells. And I can share with you a picture if that would help in terms of people being able to
Okay.
visualize it. It's really not, it's probably like a quarter of the size of a unit of blood. So it's not
Okay.
that much.
Mhm.
Um, and then those 8 bags of stem cells were then transfused into me. And because chemotherapy and radiation had wiped out my entire immune system, I was able to take the new stem cells. And so now, as a post clinical trial transplant survivor, my body functions on my brother's immune system, not mine.
Oh my goodness.
Yeah. And
Wow.
so that's how it cures. That's why I don't have. So technically now, I'm now a yes. I'm my brother's. Yeah. That's kind of how it
Okay.
works.
Okay. And your brother, did he bounce back quickly, or does he have to be in the hospital after, a certain period, or
Yes. So he, unfortunately for him, his side effects were more difficult than most. Every patient, as I say, is uniquely different because every body is uniquely different.
yeah.
But for him, after he gave me his stem cells, he was having a lot of like joint pain. So if you imagine how sometimes we have a vaso-occlusive crisis in like our hips and pelvic area, he started having a lot of joint pain there, but it was nothing that a little Tylenol
Hmm.
and codeine couldn't take care of. And
Hmm.
so he was on, I want to say he was using like a walking stick for like 2 weeks after, but that was the only just that level of pain was only side effect he really experienced. Some people have fevers because obviously your body is doing something it doesn't normally do, which is producing more stem cells. So it does take you a bit of time to kind of bounce back and regroup.
Aspect. Okay. Was this a hard decision that you and your brother had to go through, or was it just like, sis, I got you?
Um, So our story is a bit different. And what I mean by that is because he's my only sibling, he's had a front row seat to every vaso-occlusive crisis I've ever had over the course of my life.
Mm.
Um, I the process of even exploring curative therapies was different for me because I will give a bit of a disclaimer. I am a foreigner. I'm not American. I am Nigerian. And so I came to the US for vacation in 2015 just to see my brother. He worked at Amazon at the time. So I came to Seattle to visit. And then I fell ill. And then I was diagnosed with an infection that was going to kill me in 6 months. But they said if the infection doesn't kill you, then we'll treat it. And you had to be on like 4 to 5 different antibiotics for 24 months. So imagine having sickle cell and then imagine having an infection that's spread from like your lungs to your kidneys and then your bloodstream, right?
Oh, oh,
Go
okay. Go
ahead.
ahead. Go ahead. Go ahead. Go
Ask the
ahead.
question. I feel like you're gonna ask the question. It's okay.
Okay. So they told you the infection was going to kill you, but if it
Mhm.
doesn't, we'll treat it. Why not treat it before it kills you?
So they treat it, but there isn't a guarantee that the treatment will work.
Oh, okay. So they're
Makes sense?
trying. Okay.
Yeah,
Okay.
they're gonna try. Obviously, they're not gonna watch
Okay.
you deteriorate over time.
Go ahead. Okay.
Yeah, they're gonna treat it, but it's so that you don't guarantee a patient something that like some patients might bounce back, some patient it might just be too much on their body. So there wasn't any guarantees, if that makes sense.
Right.
Yeah.
Okay. Were you scared at the time, or were you just obviously you were
I
scared,
mean,
right?
you live when you live with sickle cell disease, I think from the moment you are aware of the level of your chronic illness is when you know that death could be a possibility. I think a lot of us grew up with them saying you won't make it to 16, you won't make it to 18, and all of
Yeah.
that. I think we've heard that's one synonymous conversation that I've had with different patient advocates. And so for me, I don't necessarily say I've ever been scared of death. I've
Mhm.
kind of lived my life about legacy when I leave this world, what is the memory of me going to be? What am I doing to change the trajectory of how the world would have gone with me being on this planet? That's how I've always thought about life. It was scary because at the time I was 27, about to
Mm,
be 28. So I was a young woman. I work in PR. I was an entertainment publicist for a couple of very prominent Afrobeats artists. And
mm,
so for my health to just kind of go on a fritz at the height of my career, obviously that will destabilize anyone.
yes.
And then also I came here for vacation, and fast forward, I ended up having to stay here because my health was really bad. This was never the plan. So it really
Mm,
disrupted things. But the beauty of all of that is that that is what made me eligible to participate in a transplant, because I
mm,
now was sick enough for them to
right.
consider me into a clinical trial.
Right.
So to circle back to your question, I think for us as siblings, when I knew I was able to beat this infection, I said to myself, I didn't want to live past 30 with sickle cell disease. I didn't want to have children. I didn't want to get married and still have sickle cell. It just was not for me. And so I always say that my miracle story is a week to my 30th birthday was when I found out my brother was a match. So I looked at it as God saying, I told you I got you. Like you just needed to be patient. And so
Yes.
when I found out my brother was a match, it was just a conversation of like, hey, I know this is going to be really brutal on your body. And he was like, you don't even need to ask me. Like I
Okay.
hate to see you in pain and feel helpless. So yeah.
Yeah. That's good. That's so supportive. I like that. Okay. Are y'all still nice? I mean, tight right now? Are y'all still close?
Yeah, we've always been close. I say now we're even closer because we're like pseudo twins,
Yeah.
because technically I'm running on his
Technically
immune system.
twins.
So yeah.
Right. Okay. To bounce around a little bit, before your first visit to America, you said 2015, right? When you
No,
first
my visit for vacation was 2015. My very first time in the US was 2004 for college.
2004. Okay. Well, back in Nigeria, did you know that you like were you feeling bad in Nigeria? Like, did you
Yeah,
have
of
to go to a
course.
hospital? Okay. Okay.
Yeah. So
How are the
Nigeria,
hospitals out there? Sorry.
well, let me give a bit of context for those who don't know. Nigeria has one of the highest sickle cell populations in the world.
Okay.
Um, it's Nigeria, India, and I believe Senegal, even though Brazil is coming up now as well. So
Yeah.
for us, every 1 in 4 people have the sickle cell trait.
Hmm.
So it's a huge patient
Wow.
population.
Wow.
But even though that's the reality, we're not as informed. Our medical advancements aren't what they are in the US. So even though we're all Black people, because we're all Africans, right? So there isn't
Right.
necessarily like racism.
Yeah.
People aren't informed of sickle cell disease. They still treat it as like taboo. It's still stigmatized. A lot of my close family members didn't know I had sickle cell till I came out and said I wanted to go through a transplant. So that's
Oh,
how much,
wow.
yeah, we don't, it's not something you shout from the rooftop. People, for a lot of like Afro-Caribbean sickle cell warriors, there's a lot of shame and stigma attached to having sickle cell. We don't just are out and proud like I'm a sickle cell warrior, because there's just so much that's misunderstood and so much misinformation that you end up
Hmm.
carrying it more feeling like a burden and a pariah than a warrior.
Okay.
Yeah.
Okay. What what are some of the things that they would think about that to say like you're ashamed of it back there? Like what is it?
I think people fear what they don't know,
Yeah.
right? I think even living in America now, if I was to tell let's say a friend of mine who is white or Latino, and I said I have sickle cell disease, the first thing on their face is like, I don't know what that is, right? But
Yeah.
the fact that you said disease, they're immediately like, what's happening? And then you
Hmm.
then have to elaborate. So in Nigeria, it's more that they know it's passed genetically from parents to kids, but they look at it as this child is fragile, this child is weak, this child is going to cost a lot of money because they're going to require healthcare over the course of their life. And so a lot of people don't want to be near it,
Mm.
if that makes sense.
That makes sense.
Yeah, so there's a lot of that like stigmatization when you're in school, you're made to feel othered.
Hmm.
Um, in within your social circles. If it's like raining, they want you to come into the house, so you're not playing like the rest of the kids. So from as like young as you start to understand your surroundings that like I'm different.
Yeah, they treat you different. Yeah. Wow. 1 in 4. That's a lot. What about any others in your family, any other family members? Do they have sickle cell or trait or
So our family has been really impacted by sickle cell. My dad has lost two siblings to sickle cell disease. And then I have a cousin right now who still lives. He's a guy married with kids. He still has sickle cell disease. So a
Mhm.
lot of people that are near and dear to me are impacted by sickle cell. Yes.
Okay. So what was one of the reasons that you said you didn't want to live past 30? Is it just because of the obvious you don't want your kids to have it, you don't want to be, a burden to people, or was there
Uh,
a reason?
I went through a lot with sickle cell disease. I always say, even in advocacy, that like patients were like snowflakes. Every one of us is uniquely different. We might look alike, but we're all different.
Yeah.
And I say that to mean that one person can have sickle cell disease, and maybe the only thing they struggle with is like having a crisis 1 in 4 years.
Mm,
Another person can have sickle cell disease and they're going blind, or they've lost their hearing, or they
mm,
have a vascular necrosis, or they have acute chest syndrome. For
mm.
me, I had my first surgery when I was 7.
Oh,
So, yeah, bilateral arm surgery when I was 7. And so the way sickle cell manifested in my life, it was crippling for me. It
mm,
wasn't something that I could be like, hi, my name is Wumi. It was, hi, my name is Wumi. And there is a girl standing next to me who I don't like, whose name is Sickle Cell. I don't know why the hell she's here, but she's here. I make a joke out of it, and I make light out of it, but I share that story because I'm saying I didn't necessarily want her to be a part of my life, but the rude awakening was she was a part of my life. In college, I was pre-med. I always thought I was going to get into the medical field. I really researched sickle cell disease. I had to pivot into another career because my illness, I was sick all the time. I would miss classes. I would fall too far behind. And then my junior year of college, when you're like taking genetics, anatomy and physiology, organic chemistry, was when I was like, what am I going to do if I don't do pre-med? Like, so sickle cell has made me have to tweak how I choose to live my life.
yeah.
And I've seen friends who have children. I've seen friends married, and nothing breaks my heart more than they're in the hospital and then their kids are coming to see them in the hospital, or they're in the hospital and they're missing their child's birthday. Like, I just did not want that for my life. I was like, this disease gives you so many, it's like in the fine print, there's so many
Yeah.
caveats.
Yeah.
And I was just kind of like, God, this ain't for me, boo. Like, it's
Yeah.
already a lot. This is not for me. So
Yeah.
yeah.
This ain't for me, boo. Okay. You didn't think of it like as like, maybe God gave it to you because you're so strong and like he wants you to go through it, or you just like, I know for a fact he didn't put this for me. Because some people would think,
No, I thought about it that way, but you get to a breaking point in life.
yeah, yeah,
Just because I carry it well doesn't mean it's not heavy, right?
yeah.
As warriors, we carry sickle cell and we're all doing phenomenal thing. We're in diverse industries. I don't know anyone that would work harder for you than a warrior because all their life they've been told you can't. And for us, there's that innate desire of I will, and just give me time, but I will get it done. So for
Mhm.
me, even though I learned to love sickle cell, I learned to say this is a part of my life. Doesn't mean I have to like it. So even though I looked at it as like, oh, what's the thing? God gives his toughest battles to his strongest soldiers. At a
Yeah.
certain point in time, your mental, your physical, it starts to beat you down as an individual. And so I can be brutally honest and say I got to a point where I'd had it up to here. I didn't even have the level of strength to keep going
Mm.
as a warrior. I just didn't.
Yeah. No, that's respect. I respect that. Yeah. Okay. So with the transplant, the chemo part, your hair obviously lost and
Yes.
everything. What also was a big challenge? Like, did you have to go through during that time, like in the hospital?
I think a clinical trial um, is probably one of the more challenging things anyone will ever have to go through in their life. And I say that because it's a rebirth. You were this person with this identity. And now the one thing that has defined all of your characteristics, someone is now taking that away. Who are you without that thing? So for me, one of the challenging parts of going through the clinical trial was it was a very tumultuous time for me personally as a woman because I did it in my 30s. I was not married, I hadn't had children. And so chemo and radiation affect fertility. So if I did want to have children in the future, I needed to find a way to preserve my fertility before going through the clinical trial. So I had to go to IVF. And IVF isn't something I wish on any woman or any man, not IVF, but like sperm banking. I
Yeah.
don't wish that process on any individual to go through alone.
Okay,
Right?
so let me try to get. Yeah, you're
Right.
right. Go ahead. Go ahead. Go ahead. Okay, so
Yeah.
why are you going through the process? You said it affects fertility. So the IVF, if I'm wrong, correct me. You froze your eggs, or like how does
Yes.
that work? And then after the transplant, do they unfreeze them, or
So what you do is if you are a girl, sorry, a guy or a girl, your doctors will let you know that, hey, if you haven't had children, but you want to have children, the conditioning regimen is going to significantly reduce your chances of having kids in the future. It's then up to you to make a decision. Do I want to freeze my eggs or do I want to freeze my sperm?
Mm,
If as a guy you decide to freeze your sperm, then what you would do is you would go through the medications, you would then go through that retrieval process, and then they would freeze your sperm. And then, should later on in future, when you decide to get married and have children, you can then
mhm,
go back to that fertility center to thaw the sperm and then to do IVF so that your spouse can carry the child. So for a woman, it's the same. You go through that process.
mm,
You take all the IVF medications, they retrieve the eggs, they freeze them. And then when you are ready to then have children with your partner, then you have to go back to that fertility center and then they'll implant them in you, if that
mhm.
makes
Right, right. Okay. How long was that a long process?
sense. For everyone, it's different. So for me, thankfully, I only had to go through one round of IVF, and that's giving yourself injections for 2 to 3 weeks every day. You're giving yourself 2 shots just to get your body to produce viable eggs.
Okay.
Um, and then, every day they go through like ultrasound to keep counting how many your body's producing. And when they feel like they have some that are viable that can become babies in future, then they'll go through the egg retrieval process. But thankfully, I had to go through one. But I know other friends of mine who had to go through like 2 rounds or 3 rounds because they just didn't have enough viable eggs. So
Mhm.
it pushed my transplant back by about 3 to 4 weeks.
Three,
Yeah.
4 weeks. Wow. Okay. And is that 100% like it works 100%, or were you scared that it wasn't okay? So you
There's no
took that chance.
guarantee. What they will tell you is this is for a woman, all of them IVF medications trigger crises. So they'll let
Oh,
you know, yeah, that like if you're about to go through this, you probably will have a really bad crisis or it'll trigger acute chest syndrome.
dang.
So imagine you're already prepping your body for chemo radiation and then some of the attacks on. So it's a lot on emotional and your physical body. So for me, I did IVF, and then I only had 1 week before I started chemo. So you can imagine, like, I just put my
Wow.
body through hell through that. And then I only had 1 week to rest, and then I'm back again in the boxing ring
Yeah.
trying to figure out control. It was a lot. It was a lot.
Wow. You've
Yeah.
been wow. Goodness. Okay, so did you have support around that time? How was your mental health around that? Or do you want to talk about that or
That's fine. I'm happy to share. I always say I went through things so that no one else has to go through it alone. Um,
Mm,
I would say that my mental health at that time was tunnel vision. When you're going through 6 months of the entire curative therapy process, you have to have a mentality on eye on the prize. Because if you don't, so many things will break you. I know you on your channel, you've mentioned having a port and has the best thing to happen to you. They will never use a port if you go through a curative therapy. It's too
Oh,
infection prone. So they would have to put a PIC line or a
ooh,
Hickman line. And so there are so many things if you are going through if you before you go through transplant, if you have any dental issues, anywhere there's a cause of infection, all of those things have to come out or have to be treated. So for
whoa.
me, I had to have like I think three of my teeth on the side basically just extracted because they were like, oh, it would be a source of infection. So your body is transplant every day. There's a different high, a different, it's a lot. So but what I'm happy about is I had mine done at the National Institutes of Health. And so they provided mental health services. So I was in therapy. I'm still in therapy, and I'm 4 years post clinical trial because you deal with so many things. I was also dealing with survivor's guilt. I have two friends who died from participating in a transplant and they didn't make it. So I
Yeah.
always would have that, like those wrestling feelings of like, why did they pass and why did I make it type of
Mm.
thing. So your mental health, you're going through a gamut of things. Yeah.
Wow. Wow. Three teeth extracted. Oh my goodness. Wow. Okay. So what medication do they have? Do you have to be on like a lifetime medication or how does that work? Or are you on
After
hydroxyurea?
transplant?
Mm-hmm.
So after transplant now, the only complications that I still deal with personally is iron overload. So over the course of having so many blood transfusions from when I was really young, all of the excess iron has been stored in my pancreas and my heart. And so because we don't want that to escalate into something else later in the future, every 2 weeks I have to have blood taken and just thrown away.
This is
So
every
it's
2 weeks.
interesting. Every 2 weeks. It's called phlebotomy. Mine is every 2 weeks. I have a friend who hers is every month. So it depends on how high your iron levels are. But I always find it interesting that like prior to transplantation, I was getting blood because I needed blood to fill there.
Right.
Now that
Yeah.
I'm cured, I'm having to take out blood because I have too much iron. So it's like, can
Yeah.
I win? Can a girl just win? You know,
Yeah.
but I'd take that any day over reoccurrent crises because that just it was not healthy in the grand
Mhm.
scheme of things. So I'm not on the only medications I'm on is like I'm on folic acids like everyone else. I
Yeah.
still deal with chronic pain from avascular necrosis, but I'm not on any opiates anymore. So besides that, yeah, I only see my doctor maybe once every year or once every 6 months. So I'm pretty fine.
Wow. Congratulations. Wow.
Thank you. Thank you.
Um, if you could, would you do it all over again? Like if you knowing what you know now, would you?
A heartbeat.
Wow.
At a heartbeat. My life is significantly different. And the older I've gotten, my priorities have shifted. Now I have a nephew and a niece. And I always say my nephew was my anchor because the year he was born was the year I had my transplant. And so I always feared that I would be a crappy aunt because kids have a lot of energy, right? And they're running around all the time. And I was always just kind of like, so am I going to be that aunt that can't even like play with them or play soccer because I'm like, oh, I'm so
Yeah.
tired. I'm so. And so now to have that quality of life where I don't get tired, I can carry him, I can throw him around the place, I can chase him. To me, those are the things that make life exciting and fun. And so I'm grateful that like, and even for my friends who are still warriors, I'm glad that in the way they supported me, I'm now able to support them. But the difference is now we're not both supporting each other, both in the hospital. At least
Yeah.
I'm able to be there for them, as an advocate, but also as like a caregiver, so to speak. Yeah.
Right. Right. Wow. Okay. So, your social media, I've been on your social media a lot. You have some really great things on there. It's sickle cell prodigy. What is the meaning behind that? I have a guess, but I don't want to be
Yeah. Yeah.
totally
Let's not let the
wrong.
cat out of the bag.
Oh, yeah,
Let's hear
okay.
it from the horse's mouth.
All right, all right.
Sickle Cell Prodigy started in 2017
Mm,
when at the time I was doing PR for Sickle Cell 101, which is a pretty well-known sickle cell nonprofit in the US. And the prodigy from the hip hop duo Mobb Deep passed away from complications of sickle cell disease. And as a community of advocates, we sat and we said, what can we do online to really celebrate the legacy of what he was? Because not a lot of celebrities that have sickle cell share their experiences with sickle cell or go public. And so I was like, because I work in PR and comms, I've been in this industry for 15 years. I said, just in the way they were able to do ALS Ice Bucket Challenge, how about we say hashtag sickle cell prodigy? Because
Mhm.
if you think of it, when we keep saying sickle cell warrior, the term warrior means someone that's resilient, that can fight. But we don't want to attach any additional, they're aggressive. You know what I mean? Like we already have enough labels as Black people. We don't need any more. And I said, how about we use the term prodigy because we're doing things that the average person didn't even like. We were working remote before working remote became a thing for the rest of the public. All right. A
Okay.
lot of us
Yeah.
taking like exams, taking classes while being in the hospital. And so I said, sickle cell warriors are prodigies because we find a way that regardless of what our disease presents us, we always find a way to continue to thrive and excel. That was how sickle cell prodigy was born. And so from that, what I have done is I've made it sort of like, let's reclaim our identity so that people, the implicit bias, the racism that we face, we don't want anyone to name us anything else. There's already enough floating around there. Let's reclaim the word and say, I'm a sickle cell prodigy because I'm doing something that is beyond the scope of what you think is possible. And that's kind of how
Right.
it.
That's amazing. Wow. Okay. Wow. Oh, that. And did you have help with that, or was it hard to get it started, or?
So sickle cell prodigy was kind of like my brainchild. I didn't know how it was going to manifest. Like when you start something, you don't even know if you think it's a great idea, and everybody's like, oh, do they think it sucks? And they just don't want to tell me it sucks. So when I started it, I think what I just wanted to do was I wanted relatable content, but I also wanted, there are too many conversations happening in silos. We need to, do you know how powerful we would be if we all just decided to bond together and work together? Like
Yes.
we
Yeah.
are, what's that Neo song? I'm a movement by myself, but I'm a force when we're together. So
Yeah.
I hated that. There's like, oh, there's SCDAA, there's the Community Consortium. Like we're all in silos. Why are we doing that? Why don't we just come as a collective? And so what I wanted Sickle Cell Prodigy to be was, I don't care if you live in Tanzania or you live in Australia. If you have sickle cell disease, let us be at least the base level where you start off. Let's connect warriors in different parts of the world. I'm Nigerian, but I thank God because of my privilege, my ability to go to school here, that's why I'm able to also be exposed to medical infrastructure here. I've been sick in 3 other continents. So, as far as like a global perspective, I wanted a way for us to be able to stop isolated conversations and come together as a whole. And so I started it by myself, but I give credit to every single patient advocate and warrior who has been opened enough to just be like, hey, this girl randomly reached out to me. Sure, I'll do it.
Yeah.
And I think with yours is the same thing, right? You just like
Yeah.
reach out to a couple of folks, they
Yeah.
surprisingly say yes. And what I love about the community that makes this community, well, I say this all the time. Yes, I don't have sickle cell, but I will always be a sickle cell warrior because
Yeah. Of
there's
course.
a patient you will reach out to and they're like, oh, I can't do it. Worst they'll say is I'm in the hospital right now, but I'll circle back. But they'll
Hmm.
they'll do it. And so that love that we all shared, I wanted to continue that, but I wanted to do it on an international level. And so over time, I'm building other people that I'm working with, and I'm hoping that the more that I keep doing this, the more we keep forming a stronger and stronger collective to shake the system. I
Yeah.
will say for the greater good, of course.
Yeah.
Yeah.
Okay. What do you, your own opinion, why do you think like the big celebrities won't come out like how you said and like, say they haven't?
I'm answering this question as two things. Let me wear my professional hat here. As someone who represents celebrities, people don't understand that there's a look that people give you once they know you're struggling with someone. They never look at you the same again. Sometimes as people we want to be accepted for self. There are already too many things in our head that makes us different, that when you then tuck on a chronic illness, people look at you with sympathy in their eyes. And I don't think anyone with a chronic illness wants you to feel sorry for them. They want you to respect them, but
Respect.
recognize that they might have some limitations. And so I think with celebrities there is this intense amount of pressure that they feel, that if I go out publicly with this, will people only see that and nothing else?
Hmm.
You know what I mean? And I
Yeah.
mean, let's be honest, every industry is a business. If you're trying to get work, you don't want to make a name for yourself as like, oh, that's the one you'll hire on set. And every 2 minutes they need like a transfusion and things like that. So I think those are some of the things that make coming out with your identity a bit harder. But I will say this, there are some amazing, resilient, very well-known celebrities right now that are on the cusp of doing really amazing things, and I'm happy to be behind the scenes to see it,
Hmm.
because I think that a revolution is coming, and I'm excited to see where we're able to kind of like take this going forward.
Hmm. Okay. I totally agree. I totally 100% agree. Yeah. I used to do photography for celebrities, like some very big celebrities, and I got sick, so I had to quit myself. I was their road photographer. I did photography, videography, and I was on the road 24/7. And like every state we'll go, I would just get so sick. So I understand how you say in the beginning you had to like sickle cell will tweak your, what you want to do in life. And it just sucks. Like I could have been here, but it's like I got sick. Now I'm here.
Yes.
So I get it why you did. I totally understand why you did that. So with Sickle Cell 101, do y'all still work or?
So with Sickle Cell 101 right now, I don't work for them full time. But again, it's one of those things where these are advocates that we all work together with different biopharma companies. So it's such a small space that somehow work kind of cross pollinates between groups. So I'm in a position where I still do work with a lot of these advocates, and I'm grateful to at least have the opportunity to still be able to work with them
Right,
because they're
right.
doing
Okay,
an
so
amazing job.
on your own page, I see you going, on Zoom with, a few warriors. What exactly are you doing with your page with that?
So, candid conversations started because people were having a lot of conversations offline that I didn't necessarily think, when it came to moving the pendulum, I didn't think it was moving things forward. And what I mean by that is this is there are other warriors where when I speak to on a one-on-one basis, like say, for example, one of my favorite lives was when we talked about dating with sickle cell. And I shared my story of how I was getting to know this guy, and I flew to see him for spring break, and I had a crisis, and he left me at the ER and never
Stop
wanted to
playing.
see me again.
Stop playing.
No, I'm serious. And then, my friend Blaze, who's a patient advocate, was like, girl, that was all you. That was all you, girl. Like you should have never hid that you had sickle cell. And I was like, well, speak for
What?
yourself. You're confident, but it's one of these things where like we all have different opinions. Everyone is coming from a different state of mind. But when we have these open conversations, younger warriors that are going through something similar, they shouldn't have to go through it alone. When someone else has been through it, I can be like, don't put yourself under emotional stress. Let me tell you how this ends because I've been through it. So candid conversations was for me to have conversations with like warriors, their parents or caregivers, their loved ones, their spouses, their doctors, for us to just have conversations where if a patient is watching from anywhere in the world, even if they're in their lowest of lows, they feel like they left kind of conversations feeling like, you know what, I got my laugh in. They shared some things that I never, like every time I talk about my transplant, someone else is like, wait, I didn't know that. I was talking to a warrior in the UK, and she was like, they don't do transplants. Yeah, I would have heard about it by now, you know? So as much as awareness we think that we're doing, it's not happening globally. It's just focused in the US. And so my hope is that each episode of Candid Conversations will just be an opportunity for us to just say the things we really feel, but we're filtering ourselves because we're overthinking it sometimes.
Yeah. Okay. Well, okay. So do you have a unique style of your advocacy or do you just
I do. I always say again, I'm in PR. It's my wheelhouse. It's what I know. Um, I say my style of advocacy is proactive and reactive engagement with the media. And what I mean by that is this: for the past 15 years, my job is to get my celebrities in the news. So I work with press. But a lot of times, sometimes when they publish stories or even in movies or in scripts and they write about sickle cell disease, sometimes there's misinformation. Sometimes there's stereotypes that are incorrect. And because no one is fact checking with a warrior, they greenlight that project and it's good to go. So my job is, and I've been working with Essence Magazine for this one, is writing patient stories from the patient's perspective. I don't want anyone to tell my story. Let me tell my story in my own words. Because the more we share these stories, the more healthcare will look at us as drug seekers. They'll see us as human beings. I always say, healthcare person, you should see me first before you see my race, my gender, my age, or my illness. Look at me for the human that I am.
Yeah.
And I think that's the reason why cancer has had as much prominence as it is, because they've been able to make cancer feel like it doesn't pick sides, it just impacts people. And I think until we get the world to see sickle cell as not the Black man's disease, the African descent disease, we won't get as much funding and research behind us as we need.
Yeah. That's gonna be very tough because doctors just I don't even want to get into that, but yeah. Yeah. Um, so if you saw a little girl, around 8, 7, or not even that young, like 12, that's thinking about doing the same transplant that you did, what is some advice that you would give her?
It's a bit of a tough one. Tough one because if she's 12, she's not old enough to make a decision about her body because she cannot quite think through the repercussions in future.
Yeah.
But what I will tell her parents though is that the decision has to come 60% from her.
Okay.
Because what people have to realize is the beauty of transplants is the younger you get it done, the quicker you recover.
Okay.
So, as we know, sickle cell is a progressively debilitating disease. As we age, our complications get worse because guess what? Over time, our body has been going through this vaso-occlusive crisis, blood not getting to this bone or this area, weakness happen, it starts to damage. But when you're young, you're not having as many crises because your fetal hemoglobin is still more in your blood. So if a young girl does a transplant when she's 12, by the time she's 15, you'll never know she had sickle cell because at
Mm,
that time her organs are fine. She still has her gallbladder, still has her spleen, all of her major organs are still intact. So because her recovery is going to be quicker and she'll lead a life where she doesn't feel singled out from her friends. If it's snowing, if it's summer, she can go out and have a good time.
yeah.
As a warrior, she also won't carry the emotional weight that is having sickle cell disease. So my advice
Mhm.
with her would be um, don't do as much research because that's you're too young. You don't need to know that much information. Let your parents have that.
Yeah.
But trust that they're doing this because at the end of the day, they're trying to give you as close to a good life as they possibly can. And I
Yeah.
feel like as a parent yourself, you can understand that like you just want everything and more for your child. It's a level of love that is inexpressible. Um, and so yeah,
Yeah.
it's always coming from a good place.
Yeah. Yeah. Okay. So you wouldn't recommend them to wait till they're older so they can make the other decisions about the IVF and all that, or would you just say
Because
go
when
for
you're
it?
12, right?
Yeah.
When you go through conditioning, they're not going to need to give you anything aggressive because you're
Okay.
young, right?
Okay.
So chances of your reproductive organs being because you've not started having a period yet. So more than likely you'll recover fine. So what they do is, and I think we might need to elaborate on this a little bit. The doctors tell you to preserve your fertility because it's not guaranteed that you'll never have kids. It's they don't want to tell you that you will, and then God forbid something happens. So it's more
Oh,
like an insurance policy. Right.
got it.
So I would
Okay.
say, yeah, if it's a younger person, I would say if your parents, if you are really sick, where it's
Hmm.
taking you out of school and having like a day-to-day normal life,
Hmm.
then I would say Because again, and I probably will recommend her to you. I know there's a young lady called Aminosi. She had a transplant when she was 14. Now she's in a doctorate program. She's incredibly smart,
Mm,
really amazing advocate within the space. If I met her on the street and she never told me she had sickle cell, I'd be like, yeah, girl, you look perfect. She is
mm,
in the best health of her life. And I think it's because she had it done when she was a lot younger. Yeah.
mhm. Okay. So would you recommend this transplant like only if the person is, going through a lot of crises or not? Okay. So only if they're going through a lot of crises.
If you're going through a lot of, I think it's an individual decision. I made the
Okay.
decision because I was desperate.
Yeah.
Shared, I did not want to live with sickle cell past 30. I have a friend who said he made the decision because he became a father and he was always in bed. And his wife was always the one like rallying the twins, and he felt guilty. So everyone has their reasons why they do it. But I would say if you are really sick and sickle cell is taking up maybe 60% of your life, consider it. Because now with gene therapy, you don't need a donor.
Mm.
You really don't. Like if you gene therapy, they're taking your own cells, they're turning off what produces sickle cell, and they're giving it right back to you. There's no chemo, there's no
That was
radiation.
about to be, so there's no chemo that I was about to ask.
Yeah, there's no chemo or radiation for gene therapy.
So it's the same result as what you got, but it's just a
It,
genome.
it's the same result as what I got, but the difference is there's no donor. The
So
donor
everything is
is
the same, but that's wow.
the
Okay.
donor is you. Right. All
Yeah.
they're doing is so the way gene that's why they're using the term is you can say gene therapy, but it's really gene editing. Is they're taking your genome, they're taking it to a lab, and they're turning off the thing that produces sickle cell. And so they're
Okay.
giving you your genome right back.
Yeah. So, but what?
So go ahead.
Okay, but once you get it back in your body, it wouldn't turn on. I know that's a weird word, turn on, but like, wouldn't it switch back on the?
From the research that they have done, and again, I'm not a medical expert. I wish, we have a medical expert
Yeah.
on this conversation who would go into the more detailed medical speak aspect of it, but it shouldn't. But
Wow.
the only difference is, so because I participated in the stem cell trial, they are investigating my procedure for the next 5 years. I'm in year 4. When you do gene editing, they investigate your procedure for 15 years because they want to make sure nothing else happens later on in life.
Oh, okay.
You see what I'm
Oh,
saying? But my
yeah.
friend Jimmy had his done in 2020.
Mm.
And he's on my YouTube channel where he elaborates how his process was. He was one of the first patients that they did CRISPR gene editing. And he's like perfectly fine.
Wow. How long did it take?
For him, 4 months, 4 or
Wow.
5 months. Yeah.
And are you in the hospital all these 4 months or?
You are in a hospital for a few weeks and then they let you go home, but the home they give you is like hospital housing, so it's not like you're like going across the country. You're staying somewhere close by because from when they take your cells and they go and edit it in a lab, that takes I think 2 weeks or 3 weeks before it's kind of like the way I was explaining how you do conditioning before everything
Mhm.
is like in a step-by-step process. So with gene therapy, it's similar, but I believe it's like 4 to 5 months. I don't want to misspeak. I can clarify that, but yeah, I think it's not longer than like top 6 months. Yeah,
Wow. I did not know that. Wow. Okay.
yeah. So I'm excited for that because that would be a universal cure. That would mean no
Yeah.
one has to wait for a donor. Not as
No.
you don't need anyone now. You're not begging mommy. You're not begging siblings. You can literally just say, "I'm sick enough. I classify for it. Can I afford it? Yes." And I can go. And if this is what I'm wanting to do, I can go ahead and get that done.
No chemo either.
Yeah.
Wow. I did not know that. That just opened my mind. Wow. Okay. So is there any other my mind is blown off that. I did not know that. I'm sorry. Oh man. Okay. So is there any other, things you want to get off your chest or tell the sickle cell community or anything
No,
you
I
want to say?
think I like this conversation that we had. I'm
Yeah.
hoping, you learn a thing or two. I always hope that when I have conversations with people,
Yes.
we both leave feeling like
Yes, I
it felt like
did.
a conversation, not an interview.
Yeah.
Um, but my hope is I just want to encourage the young warriors. You guys are growing up in a very different time. We grew up where there was no social media. And so some of the words I know now, like one of the things we always share with each other is like, I didn't know anyone else that had sickle cell. I thought it was just like me, and now with social media, with more people going public, you don't feel as alone when you're going through a really difficult time. I think even with your channel and your audience, when you talk to people, there's a connection you make with them, even though it's virtually, where it feels like you've met them, but not really. And I think I'm happy that the younger audience gets to see that because maybe then they won't walk around feeling so burdened by sickle cell disease. And that makes me happy.
Yes. Yeah, that's one reason I started this. I was in the ER one time long ago, and this guy, he was like 15. He was like, "Oh, I'm in the hospital. I have no clue why." And I was like, "What have you been doing?" He was like, "Oh, I just turned 16 or something. And I drank 2 bottles of Hennessy and my body hurt. And they just told me I have sickle cell." I said, "Bro, you were tripping."
Oh my
Like
God.
so but I talked to him for a few months after that and I got him right. But
Okay.
okay, so one last question for you, so we can get up out of here. How has sickle cell affected your life in a positive way?
Sickle cell has blessed me with my favorite character traits.
Okay,
Um, I'm empathetic in a way that I value. There's a level of care that I have for people when they're going through difficult, like health. I always say, even in my family, I'm like the doctor in training because when anyone is sick, they're like, Wumi, what do I do? And I'm like, do this. I think it could be this, but no, it could be this, but let's try this. Um, and so, and that's just like, when you have sickle cell, you're faced with a lot that eventually you start to know and understand how the human body works. So I
yeah,
like that. I also think that sickle cell has made me one of a kind.
okay. Yeah.
Um, it's made me see life from a lens of kindness. I
Mm,
lead with kindness because I know how on my more painful days, all I'm looking for is someone to treat me with kindness. And so I lead like that every day of my, and then I live my life to the fullest because sickle cell never gave you a ton of time. At least no one knew how long we had on this earth, but it made you really savor the moments of life that people take for granted every day. So that's been
yeah.
my thought.
Okay. Great answer. Great answer. Great answer. Well, thank
Mhm.
you so much, Wumi. I really appreciate you for coming on.